Hi, I'm Dr. Prashantha Kesari, Senior Cosmetic, Plastic Reconstructive and Microvascular Surgeon practicing out of Nypunya Plastic Surgery Team, Bangalore, India. We evaluate facial palsy on different parameters. Say if somebody's eyes are not getting closed and his cornea or eye is in danger, then we prioritize it and we do what is called tarsorrhaphy to just protect the eye for time being and allow the facial nerve to recover. So it is very important for us to assess if a facial nerve injury that has happened is recoverable or it is permanent. So if it is recoverable, it is very important for us to wait, but nothing gives results like recovered facial nerve damage. Okay? We can't replace what a normal God-given facial nerve does. So we wait if there is signs of recovery and if the nerve is not cut and just has what is called neuropraxia. If it is cut, then if it is immediate, we repair it off so that the same nerve conducts the electric signals from the brain to the facial muscles. If it is because of some reason it has taken lot of time and we can't find the nerve, like main trunk of the nerve which gives signals, then we connect it to another nerve called nerve to masseter. So that nerve will power the muscles of the facial expressions and restore. See, basically we borrow these electrical signals from other nerves when the natural nerve trunk is not available for us to connect it to the end of the nerves. So we take sometimes from the opposite side of the face called cross facial nerve grafting. And this is basically like आपका घर में you have lost electrical connection and some cables are cut. If you can't find the cables which are coming from the main transformer, what you do, you can take it from another transformer. No, it's exactly like that. We try to get the electrical signals from other sources, other nerves. In case if the muscles are not good and there is lot of time has lapsed, more than 1.5 years and it has not recovered, then we replace the muscle activity with other procedures. We do what is called sling surgery, where we connect it to another muscle in the side of the head, and we also connect it endoscopically if it is only this angle is deviated. And apart from that, we also transfer small muscle from thigh called gracilis, connect its blood vessels as well as nerve in the neck, and we replace the muscles of the face with this muscle, and this is called functional muscle transfer. So there are definite indications for each of them, and we do all of this depending on what is the best thing suited for you.